Hey team, I'm excited to share this episode with you today. In today's episode, we'll be clocking in with Physician's Assistant, Mr. Hurt. But don't worry, he's here to fix you, not hurt you. In this episode, we'll be learning about Chandler's journey becoming a Trauma ICU Physician's Assistant and all of the influential people that helped carve the way. Shout out to Dr. Goldberg and Zane. All right, let's clock in. Bro, Chandler.
Hey, good to see you, man.
Thanks for coming today.
Absolutely, pleasure.
How's it going so far?
Good, man. Good. Long weekend, but it was a good one. Got to spend some time, hang out with the girlfriend, and have some time together. It was a good weekend.
That's cool. You went to, I saw it looked like a wedding, but you were telling me that it was a gala?
Yeah, gala. So we went to a gala with, it's a National Kidney Association. And one of the doctors that I work with currently, he is an amazing dancer. And so he actually got invited to be one of the dancers there.
Oh.
And so he performed a dance there, and it was awesome. We went there, a whole bunch of people from the hospital I work at. We all went to go support him there, and it was a great time. You know, there's cocktail hour. The dinner was great. The dances were awesome. We got to watch like 8 different routines from a whole bunch of different people. And then afterwards, they open up the dance floor to everyone. We got to go out there and have some dances afterwards. And then we all had some cocktails after. And then we went home and then recovered yesterday.
Bro, that was not at all what I was expecting. Maybe I missed it, but when you said that you went to this kidney... What? Kidney what?
A kidney. So it was like kidney donation, like Arizona, like just kind of National Kidney Foundation. It's like all to help support like kidney transplants and like, you know, renal patients and everything like that. So it was just a big like event to kind of help support them and grow some awareness and kind of get that all out there.
But the dancing part,
the dancing, yeah. Highlight. So yeah, that was the highlight. It was kind of like they called it coworker, yeah.
Whoa,
one of the doctors I work with, yeah. So he actually did it, and they called it like Dancing with the Stars.
I was gonna ask.
Yeah, Dancing is what the Stars is how they like themed it and everything like that, because everyone there is like, you know, I think there was 3 other doctors in the group, and I don't know what all the others did, but I'm assuming they came, you know, from big organizations or such, and everyone. I mean, dude, everyone was crazy good dancers. So how it worked is everyone that danced that was like one of the 8 participants, they were like, I would assume they'd be called amateurs. I don't know for sure, like how they would classify themselves. But then they all danced with like a professional that was with them.
Oh, whoa!
Yeah. So like, because they all like are like I know.
So it
like,
is Dancing with the Stars energy, but it's like Dancing with the Doctors.
Mm-hmm.
Okay.
Yeah. So it was sweet, man. I actually really liked it. I was talking about like when we all decided to go as a group and everything. I was like, man, I don't know like what to expect here. So like I totally went in like just naive, and we left there and I was like, dude, that was awesome. Cause like, I don't know anything about dancing, but I was just like out there, like, this is great. Like someone did a dance to Evanescence.
Oh, nice. That's kind of like Rocky.
Yeah. And
or not Rocky, the movie, but like that rocks.
Nice. Yeah. You know? Okay. So I couldn't believe it. Cause I guess whenever I've always thought of dancing, like I just think of everything
ballroom
like so proper and everything. And so there was a little mixture of that. Like some people did some proper dances. Mm-hmm. Some people did like, I'm sure it was still like proper technique, but they did a little bit more like, you know, fast paced stuff and everything. So it was really cool to see all the different, like, I have no idea about it, but it was cool to watch.
I was going to ask because one of my friends, he just really got into a style called shag.
Oh, okay.
Do you know what that is?
No.
I can't describe it, but it's it's like maybe what swing dancing is, or maybe swing dancing is like underneath shag, or some other thing. And so I was curious to know if that was, and maybe that's what you saw with the fast feet thing.
It probably was. You know, like I felt like I was in an episode of Footloose.
Oh, bro, that's lit. Actually, I've never seen Footloose, so I wouldn't know.
Oh, dude, you got it. That's a good one. I don't know.
Is that Patrick Swayze?
Yeah, okay. And then there's like a newer one that came out too. I can't remember like how long ago it came out, but it was out like fairly recently. I think over past like 6-8 years probably.
Okay, gotcha.
And it was okay, but it's not as good as the original.
I'll check that out. I've only really seen like Step. Oh no, what is that?
Step up,
step out.
Yeah.
Hell yeah, dude.
There you go. Now we're talking. Yes, now we're talking, dude.
That's so cool. It's really cool that we were able to finally link up. We've been pushing this for like weeks, and so kind of glad that it worked out today on St. Patty's Day. We're both wearing green.
Absolutely. You know,
dude. Last time I texted you because we were trying to link up, and you texted me back, sorry, bro, still working, had to deal with some stabbings or something crazy like that. That's actually... And then I just laughed because I was like, that is so absurd. I never... Like, no other friend would text me that.
You know, just like, I just stated how it is, you know, just out here in the jungle.
Literally, bro. I was like, bro, what are you saying right now? Dude. But everything was good with that?
Yeah, man, everything was good. Yeah, it's, you know, every day brings a little something different. Just depends what day of the week it is usually.
Yeah, that's so funny. So you are, what is your title? Like, what do you do?
Yeah, so I'm a physician assistant. I think... And I don't know, for anyone that might know, you can correct me. I believe you can interchange us with physician assistants, which is what I was known as. But recently there was a name change, but I still think we go by physician assistants. But you look us up, sometimes you might also see us known as physician assistants, or associates, excuse me. See, it still feels weird to me. So
physician assistant versus physician associate.
Yeah, because the thing that was supposed to be is like, because people were hearing like assistant, and, you know, if anyone in medicine, usually, you know, you're familiar with a certified nursing assistant. Mm-hmm. So like people were like, oh, the PA is like the CNA for the doctor.
Gotcha.
And it's like, that's not how it is at all. Because like we work coincide with them, and like, you know, we come up with a plan as a team and everything. And it's not so much like, you know, this is, you know, the doctor telling us to do and such. We have a lot more that we can say and do and stuff like that. But I think that was one of the reasons why they wanted to change the name a little bit, because people were getting kind of a bad reputation with the assistant part of it.
Gotcha. Yeah, not at all saying assistants are bad, but I think there is a significant difference between, like, Elizabeth is an OT, occupational therapist, but there's like an OTA, occupational therapist assistant, and then same with like physical therapists. And it is completely different, or in the sense of like one requires like significantly more schooling. So it's like physician's assistant doesn't necessarily mean like you don't not know stuff. Like you still have to go through a lot of school.
Exactly.
For that, right?
Exactly. Yeah. A lot of school, but it's still like by no means do we do, like you said, as much school as like the physician does that we're working with and stuff like that. So they usually do a lot more training, because typically I think, you know, depending on what type of physician you're talking to, you know, like if they're a surgeon, they went to a lot more school than like family medicine technically, but overall they all do more school than like a physician assistant.
What kind of schooling did you have to do?
Yeah, so I went and I got my bachelor's in zoology. So I did like a 4-year at where I did my undergrad.
Bro, like studying zoos or?
No, so at my...
I kind of feel like an idiot for asking that.
No. People always ask this because they find it super interesting. And most people don't know this about me, because so when I went to school, the school I went to at the time, I think they've gotten more pathways now. But when you wanted to go into medicine, which I knew I wanted to go into pretty early, you pretty much, you know, the major tracks, so you can get, because essentially all you need to do is get your prerequisites that you need to apply to PA school. And that usually includes like, you know, some math, obviously a lot of science, but the major things of science it wants are like the biology. There's some biology, cell biology, anatomy, physiology, and then some chemistry, specifically biochemistry, organic chemistry, and a few general chemistries, a genetics class, and I think that's about it for like the major things. We don't have to take physics, or at least when I applied, I didn't need physics. I know that's one of the major things outside of a few other like general classes that differenced me from doing like PA versus like MD, like a doctor route, because, you know, I didn't want to take some of those extra classes that are required usually to apply and take the MCAT and get into med school. I didn't have to take those. But so 4 years there, and then after,
okay, that's still undergrad.
That's still undergrad.
Okay,
yeah.
gotcha.
So that's all undergrad prerequisite classes that are needed to even put in an application to somewhere. And so then once you finish like with your undergraduate stuff and your prerequisites and everything, you go into a website called CASPA. CASPA is essentially a portal to keep track of all of your information, aka like it's where you put in all your grades for every different prerequisite that it wants. So it would be like, oh, biochemistry, what was your grade? And then it will calculate your average GPA based off of your science GPA. And then you put in your other classes that you took that aren't in your science GPA, and it will give you your overall GPA. And so then that will apply you, and that's how schools will use you to like rank in their process of being like, oh, okay, so, you know, we have Chandler here. It looks like he did this. His experience and background, you know, he did this, this, and that. And then after that, you put in like your personal statements. That's where your letters of recommendations go. And then once you get all that out, you pay, I think it was $50 per place you apply to.
Okay, gotcha.
And then that website will do all the rest. They send it out.
It'll push them out.
It pushes it out. And then.
Gotcha. So they're like a broker or something.
Exactly.
Like that. Okay.
And then once the schools get it, it's on them to, review everyone and then send out their letters of invitation for interviews. And then you go to the schools and you interview. And then assuming you get accepted, then that's good. And then you go to PA school, and PA school is 2 years.
Oh,
like I think it was like 2.25 when it was all said and done, because there's a little bit like extra in that, but it's pretty much 2 years.
Okay. I always thought it was 3 years, so 2 to 3 is pretty good.
Yeah, 2 to 3 is pretty good, yeah.
Wait, that's even shorter than Elizabeth's. Mm-hmm. That's so interesting.
I say that all the time because in my schooling, we did a lot of like educational stuff with a lot of like PTs and OTs, and I said the same thing too. I was like, oh man, I had no idea you guys are like doctorates. And like, yeah, so we're
and
just.
You too, right?
Well, no, so we just have a master's.
Oh, gotcha.
Yeah, so we have a master's. That's what our master's of physician associates is what we end up getting.
Gotcha. I think maybe the doctorate ones are the 3 years, maybe?
Yeah, it could be.
Okay, I see. So was PA school pretty rigorous? Like, what did you have to do for the work?
Yeah, so PA school was pretty intense. So they do the first year is all didactics, meaning it's all like book stuff and like in person practicing like physical exam skills, practicing like, different techniques of like, procedures and everything. That's the whole first year. And during the first year, it's like, at least where I went to, we had like an exam almost weekly. At least.
Oh, wow.
And then some weeks were like of 2 and everything. And so it was a lot. It just depends like how you are. Like I'm that person, like I had a buddy that I did school with that I loved, and he was just, he had a photographic memory, and so it was super easy for him, right?
Jealous,
because
bro.
Yeah, exactly.
Dude, you're like, bro, share the brain.
Exactly. He's over here, he's got like 3 kids, and I've got like none, and I'm over here putting in like 18 hours into this test to get like 10 points less than him, and he's like, oh, I studied like the night before.
I just remembered it. I don't know.
But that's always how I was though, even in like undergrad. I was always the person like I had to put in the work because like I'm not a good test taker. I'm a terrible test taker. So like PA school was awful for me because
it was all tests.
I hate taking tests. Yeah. And so I get super bad test anxiety, and it was like, okay, come on,
literally,
like,
I'm sweating,
and the worst part is like when
nightmares.
you start PA school, they like give you this whole rundown of like, okay, you have to get this grade and this grade and this grade, and if you don't reach at least these marks at this point, you get kicked out, and you're like, and then like it's about the same. This is also the same day they're telling you how much tuition costs, so you're like,
bro, you're like, I can't fuck up.
Oh man, okay, shit.
Literally.
So like I have to pass this.
Nice.
So yeah, it was stressful, but it's great. Like we had I think class sizes vary like drastically. I think for the most part, everyone I would say for most I applied to were like 30 to 50 like students in their program.
Oh, gotcha.
So it's pretty nice. You have a pretty like intimate setting. So like you get to know your classmates really well, and you can find study buddies really good. And everyone to get in, it's not easy. So everyone's like, really good students.
Oh,
and
cool,
so
yeah.
Everyone's looking to do the same thing. And once you're in, you're just trying to like make it through. You don't have to like excel at the classes. It's just like making those benchmarks they need.
Keep above that threshold that they have.
Exactly. So
I think Elizabeth had something similar where it was like, if you can take this class, but you have to get at least a B or something, and you get 2 attempts, if that, or something like that. Or maybe it was a test, like you have to get above a B on this test or whatever.
Yep.
Interesting.
Very similar process. Very similar.
Did you have like rotations or anything?
Yeah. So when we were done, I think, oh man, you're really going to make me try to remember. I think it was 10 or 12, but
10 or 12 rotations?
Yeah. Cause what you do is let's see, I can maybe remember them.
Like once a week?
So monthly.
Oh,
monthly.
Oh yeah. Okay.
So the first year is all didactics. The second year is all rotations. So I think there was probably 12, cause that would make sense. 12 months in a year, right? So I think it was probably 12. So the mainstay of like physician assistants though is because like they started back in I can't remember what World War, I want to say 2. I just know Duke was the very first PA program, and it started out because like there was a war guy who came back from the war, and he was like, hey, I can use my skills, but like I'm and so I can't remember the government got started. Anyways, long story short is that's kind of how it got started. And so from there, like everyone kind of opened up to kind of broadening like PA schools and everything. So that's where we landed. But the mainstay they were trying to get is more people to help the geriatric patient population that were coming home from war and needed support and everything and treatment and such. So they didn't have enough people to help the amount of people that were coming back of age that needed support. So
that's interesting.
Major thing is PAs like are trained around is like family medicine or like general like medicine that anyone in the community should hopefully be able to treat. So we did 2 family medicine rotations. You do a rotation in women's health. You do
so these are like different like industries or other things that physicians assistants are generally like working in, like the environments that they're working in.
And they're all considered like different like specialties, and then you can have like subspecialties like within that, because you can be like a neurologist, like a brain doctor or a brain physician assistant, but you can also be a pediatric neurologist. So like that would be like a subspecialty of neurology. You know?
Tracking, yeah.
So we did that. So psych, women's health, family medicine. You had a surgical rotation, some sort of surgery rotation. And
bro, you like. I think the other night you were saying something how you have like a suture kit. Is that like what that means, bro?
Yeah, well, no. So like even like when you do your surgery rotation, you're like in the OR,
bro,
and you're like, you know, whatever surgery they're doing, like if they're taking out your gallbladder, like they're in there helping however you can in just doing whatever, you know, the surgeon at the time asks you to like help with, or the PA that you're with asks you to help with. So a bunch of different things. So yeah, it's pretty cool because you can, and then you pick 2 electives. And you can pick whatever you're kind of interested in. You know, you're supposed to be using your electives to either go into something you're interested in, like that you know you want to do, or something you're kind of curious about. So, for example, I always knew I wanted to do ICU, critical care medicine, which is where I'm at currently in the ICU as a critical care physician assistant. So I did my rotations specifically in an ICU. And then I did my elective rotation in a transplant ICU.
Okay, what's a transplant?
So all for different types of transplants, like liver. It's usually solid organs, so usually like liver, kidneys, and then the one I was at was specifically like mostly livers. But any transplant, you know, they'll do lung, liver, kidney, heart, lung.
The big organs.
Yeah, they'll do, and they do intestines too. But I just have never been anywhere that's done intestines.
Okay, wait. So in the transplant department, I guess, like, what are your thoughts on like pigs and stuff? Is that bullshit, or is that
no?
Like,
so
real?
It's real. They're definitely starting to do it. You know, use some more like animals to like, you know, transplant. It's definitely not as common, and I still like don't know all the literature on it and everything. I think it's something they're stepping into, but I mean, you think about it, most of the valves we replace of people's hearts now, depending on like what the surgeon finds appropriate for them based off of their age and everything that's going on. A good portion of valves that go into individuals for like heart surgery is pig.
Bro, really?
Yeah.
Oh, interesting.
Yeah, usually. And they might do mechanical for various reasons, but a lot of them will be pig.
Okay, yeah, I was thinking mechanical for some reason.
Yeah, a lot of them will be mechanical, but there's certain reasons why they'll do others and everything. But for the most part, some of them will be pig.
Gotcha. Okay, so the rotations, do you think that kind of like helped you find which environment you wanted to be in?
Yeah, and I think it helped you find what you wanted to be in. It also helped you find the ones that you definitely didn't want to be in, right? Because like that's like the ones that I helped notice that like I knew I didn't want to go into. For example, like I knew I didn't want to do any surgery things, like be in the operating room, because not that you don't do this, in my opinion. I wanted more of that like being able to talk to patients, and obviously,
bro, you're like knocked out for the anesthesia or whatever.
Yeah, like I'm just talking to them while they're asleep and everything.
Yeah,
like
literally.
It wasn't for me, so I was like, I don't really want to do that. And like those guys are like crazy good with their suture techniques and everything. And like I do sutures now, but they're just basic. And those guys are doing like super fancy ones with their hands and like all sorts of really cool stuff. So I was just something I knew I didn't want to do. But then I did rotations that like I didn't think I was gonna like, that I actually really liked. Like I went and did my family medicine rotation. That was cool. But actually, like one of my favorite medicine rotations I did was with an internal medicine doctor. I think I can say his name. Can I say his name?
Sure.
Dr. Goldberg.
Hell yeah! Shout out Dr. G.
Yeah, Dr. Goldberg. He's awesome. He would love this. I'll have to send him the link. He's a great guy. But he was so cool. So he's like an infectious disease like guru. So he works all around like crazy bacteria that like people will get, and he treats. But he's also an internal medicine doctor. And for anyone who doesn't know, like internal medicine doctor is equivalent of like I shouldn't say equivalent because people are going to be like, no, they're not. But in my mind, they're very similar to like what you do family medicine out in the clinic, but they're the person who's doing it in the hospital. So they're kind of like, they're the knower of kind of all. They get they have a very good grasp and understanding of pretty much everything the body has to offer. And then like if they need in-depth knowledge of like a certain, like say they need know something about the liver specifically, they'll ask like a hepatologist about it kind of thing. But anyways,
they're like the first layer or
like,
I mean like maybe the last layer of the hospital, or something like that.
Yeah.
Okay, gotcha.
And so he was cool, but I loved his rotation because like he made it so fun. Like he made it very like open and like made us feel like we could come to him for anything, and he taught a ton. Like he was super good educator. So it was cool. Like we had a bunch of different rotations and we did them all over the place, which was cool too. You got a little bit of everything. So I trained up in Wisconsin and I had rotations like in Milwaukee. I had rotations closer down to Illinois. And then
you traveled.
I did. I traveled. And then I even did a rotation back in Utah where I'm from originally. So I did like some rotations out there. So it was cool because I mean, pretty much the school will set up your rotations for you, or at least mine did. But you do have the option of, if you can find people that are willing to take you on as a physician assistant student, and you can go there and rotate with them. Be like, so like if you were a doctor and I could be like, dude, Steve, hey man, can I come do a rotation with you? And you'd be like,
bro, come in.
That's great. Yeah, let me know. Let's do, how's Tuesday next week sound for you?
And you're like, oh, hell yeah.
And as long as it was cool with your school and you made it work, and
Interesting.
they could come do it and everything. They have to come do like there's a few things they have to do, I think, from the school side to make sure it's cool.
Or like it's
to,
like a real hospital or whatever.
Yeah, and they got to go and like inspect it and make sure that like they're like, okay, you're going to get what you're, because each rotation you have like, things you're supposed to be learning there based off of the criteria that's based off for physician assistant schools that's each student's supposed to get on each rotation. So they go through and just make sure you have that done.
Okay. So you are a ICU physician's assistant right now? Okay, gotcha. Yep. Is that what you've always been in?
Yeah, that's always what I've been in. When I finished school, a cool thing that I got to do, which is not something I don't think many people do. I think it's becoming more popular. But I actually did a fellowship after PA school. So a lot of times when you finish school, you can just jump right into your career. But there's things called fellowships or residency programs for PAs.
Okay.
Nurse practitioners can do them too, because mine was a nurse practitioner PA program at Emory University. And we were able to go, and it was a specialized program specifically in critical care.
Oh, cool.
And so we got to experience for a year, one full year of like training. We got to go to each different ICU. So we had rotations in their cardiovascular ICU, so like heart and lung ICU. Their regular like medical ICU, like basic, like you have respiratory failure, like pneumonia kind of stuff, or like you have an infection in your bloodstream and stuff. And then we had one in the surgical ICU, which is like anyone obviously that had surgery that's intensive care unit afterwards that needs that. We had a neuro ICU, so like a brain ICU. And then we did rotations we did it in the OR with anesthesia, and had rotations with them. We did a rotation with infectious disease, nephrology, and just the cardiac, so like the heart ICU.
Wait, so this residency, was this all at one hospital? Because that sounds like there's like a lot of different disciplines. Mm-hmm. So is this like a pretty big hospital?
Yeah, so Emory's pretty big, and they have a lot of different hospitals in a few different areas.
Oh, Emory is a hospital.
Emory's the hospital, yeah.
Gotcha.
Emory is the hospital, Emory healthcare system, and then within that they have because there's like Emory Midtown, there's Emory University.
Oh, there's
hospital.
like different areas.
Yeah, there's different little ones,
Gotcha.
But their university hospital has like a majority of them. They would just send you to different ones so you could kind of see what it was like at some of these. And so that one was really cool because when you're done with that one, I don't think all residencies or fellowships do this, but at that one they guaranteed you a job after you were done. You just they just, whatever positions were open and available, they were like, hey, we have a job opening in the neuro ICU. If you're interested, we'd love to have you, or that kind of thing. So
it's like a 1-year internship for free, but at the end, you're most likely guaranteed to get a
it's
job.
not free. You make money. You make money while you're
nice.
there. Yeah, so you make drastically less than you do when you're done.
Oh,
but
yeah.
at least you're not there for for free. Yeah. So and I mean, after you've been in PA school and you've been giving money to the government for X amount of years for your student loans, any bit of money, you're like, oh,
Yes.
dude, this is money again.
I
Like,
accept.
and you're like,
Literally.
you're still like looking at your bank account. And you're like, oh, I'm still negative. How much? But okay, that's fine. You know,
Literally.
it's still something. So
That's so funny. Wait, so how long have you been a doctor or a physician's assistant for?
let's see, 5 years. 5 years. Yeah.
Oh, bro, that's
Because I was done in 2020, and
okay.
so I've been for
Damn.
about 5 years now.
You couldn't walk because of the COVID?
Oh,
When did you what month?
yeah. So so my rotations actually my last 2 rotations were canceled about in person.
Wow.
So we did our last 2 rotations like online modules because like what else could they do? So we did do a walk. It was out in a park, and everyone was social distancing, and everyone wore masks and everything. And it was like when you went to take your picture with like your like gown and everything, it was like pull your mask down real quick, take a picture, put your mask back on, and then like it was a major bummer because you're like wanting to like tell all your friends and everything like so congrats, and you're over here from the side being like,
Thanks
oh, hey, Bill. Hey, man, congrats, So it's just like crazy aspect of things. But yeah, so 5 years total now.
Okay, gotcha. What got you into being a PA?
So I have probably like one of the crazier stories of why I got into a PA. And I don't think I've ever told you this. So you're probably going to be super interested to hear this. So when I was, I couldn't drive yet. It was sophomore year. It was just starting. So I was probably 15, right? 15. I remember specifically we were like, I had just finished like, so in Utah, because I heard that it's not like this everywhere else. In Utah, you do 7th, 8th, and 9th grade at junior high. And then 10th, 11th, 12th is high school.
Okay, yeah.
Or
That's
at
not
least
like
the high school I went to here. So
gotcha.
So and I finished 9th grade, going into 10th grade. I was like
New school,
and I wanted to play football. And I had been playing football, and I really wanted to play like at a higher level. I was like, man, I want to try to make like varsity. I'm gonna do this. So
first year varsity.
So my parents go out of town. They're going somewhere out of the country. I think they went to like Mexico or something. I don't know, for a vacation. Those two. And so while they were gone, my cousin was watching us, and so during this time, I was like, oh, you won't even have to watch me. Like, but she was going to be there for my brother and sister because I was like, I'm not going to be able to watch them. I have football practice. So in the summer of like football, you do these things called like 2-a-days where it's you go there in the morning and then you go home and you like eat, nap for a little bit, then come back, practice again. So it was like during that time frame. And I remember my friend's mom driving us, dude. And I remember just being in the car, and I was starting to experience some weird things.
Oh, cool. Oh, because you were doing 2-a-days, and so you were like exhausted.
Well, so I thought. More to the story to come. I was like, dude, I'm like never been this tired before. Like I was like falling asleep on car rides.
Wow.
And then I started noticing some other weird things. I was getting nosebleeds. Like I'd never had a nosebleed before. I was getting like nosebleeds that like I couldn't get to stop.
And mom's gone. And you're like,
and mom's gone, and my mom's a nurse. So like I'm like, well, so then like, my cousin's there with us too. And so we're just like trying to be like, common sense about this. We're like, well,
hold your nose
and we're like, it's Utah, it's in the summer, we're running all day. I'm probably dehydrated. So like, sure enough, we're like, probably just need to drink more water. I'm outside running all day. That's probably why I'm tired. But then some other weird things started happening. I started getting some like crazy bruises. Like I'm talking like they aren't just like your run of the mill, like little blue, little yellow. Like I'm talking like black and red bruises. Wow. And they weren't just like normal size. Like I had one on my hip that like started at my hip and came up like probably to my mid rib, and just a huge bruise. And I was like, talking to my cousin. I'm like, I have no idea what this is from. And she's like, well, it's football practice. I was like, yeah, but it's like in the summer you can't hit with pads. Like you can't even put pads on. Like it's like not allowed. And so I was like, but we haven't been doing any hitting. Like I should not be getting bruised like this. I was like, they don't hurt or anything, and everything else outside of the nosebleed and like being tired seems pretty normal. So I was like, whatever, it'll be okay. So my parents were gone for about a week, and they come back, and I remember my mom comes home. And my cousin's kind of telling her about some of this stuff that's been happening to me. My mom's like, being a nurse, like in healthcare, we might not always know, at least me personally, I might not know exactly what's going on, but I'm going to have enough knowledge to be like, it's not normal. Like, that's weird.
Yeah.
And so she was like that. And so I remember specifically, and I was out on a date, dude. I remember, and her name was Cammie. And I remember being out with Cammie, dude. And we were in a movie theater, and I just remember hearing my phone. Bzz, 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 bzz. Stop. Bzz, bzz, bzz. Like, dude, I'm getting phone call, text. I'm like, what the heck? But it's, it's like I'm like 15, 16. So it's like a first date. So I'm out there like,
Yeah.
Cool. You know.
Right. Yeah.
And then,
like, don't be a buzzkill
dude,
right now.
yeah, totally. Because I'm
okay.
like, dude, I like this girl. I want to like go out again.
Yeah,
and stuff.
yeah.
And so I remember her like leaning over in the movie, and she's like,
turn it off, dude.
Do you need to answer that? And I'm like, no, it's okay, dude. So we get out of the movie, and I just finally pull up my phone. I had a flip phone, you know, of course. And I flip that bad boy open, my Samsung, and I'm like, oh man, my mom's freaking out, so we need to go home. So it's like just text message from him, like, you need to get home now. So I get home. The other thing that was really kind of weird, that this will chime in on this part, I was starting to get like, they're called petechiae, but what they are, they look like freckles, but instead of like brown, kind of like a freckle, they're red. And so what it is, like, they're little like micro little like bleeds underneath you, and I was getting them like everywhere, like all over the place. And so I was like, I don't know, I didn't know what to think about it. I mean, I was just noticing.
Is this
like,
puberty?
Yeah, I'm like just noticing weird dots on me. So I'm like, whatever, it's fine. So I remember I come home, and at the time, our next door neighbor was an ER emergency medicine physician, and so my mom, while I was gone on the date, had called him and was like giving him kind of my symptoms, and he's like, I don't know, man, that sounds like ITP. And my mom's like, so she's a nurse, so she's pulling out her nursing books, and she's like,
what's ITP?
ITP. So ITP stands for idiopathic thrombocytic purpura.
Nice.
So idiopathic meaning like they don't know what causes it. And so there's some, you know, conditions that will be idiopathic because they just have no idea. Purpura describes the petechiae that I was getting, but usually they're in bigger blotches. Like petechiae is the singular version of purpura.
Okay.
So purpura is more like a big spot. And then
which would be like a cluster, but in this case it's just singular.
Yes, exactly. And then the thrombocytopenia is just low platelet count. Because thrombo is like clot, and like thrombocytes are your clot forming formation of your blood. So like when you're thrombocytopenic, you have a low platelet count.
Gotcha.
And so essentially, like, that's what he thinks I have. So mom's like, you need to get home. So remember, dude, this will be so embarrassing. I'll have to tell her to listen. So I get home, and dude, she was like, hey, he told me he needs me to do a few things when you get here. He said, can you open up your mouth for me? And I was like, yeah, sure. And she looks
wait, there's your mom.
My mom, yeah.
Okay, gotcha.
And so she's like, I'm gonna look in your mouth. So she looks in her mouth, and she's like, oh my God. Like, she's like, my mouth was full of those red dots.
Interesting.
Like inside my tongue. And I like, you know, I hadn't looked at that. I don't look in my mouth. Like, who looks in their own mouth and is like,
that's different. Also, you're 15.
Yeah, exactly. Like, dude, nothing's weird to me at 15,
yeah, literally.
Right? Like, you know.
Our body's going through changes.
Yeah, I'm just letting it do its thing at this point, you know? And so she does that, and then she's like, yeah, and then my mom like drops the weirdest question to me, and like as a 15-year-old, I was like, no. She's like, can you drop your pants? Like, he said like it could be everywhere, and I was like, what? And so like, sure enough,
I can check.
Drop drawers, and she's like, yep, it's everywhere.
Bro, it's on your penis.
Yeah,
nice.
And so she's like, okay, well let's go to the ER, because he's like, if it's all like that, you need to come to the emergency room. So I go to the emergency room. Luckily, we know him, so he gets us in pretty quickly. They draw some blood, and he comes back, and he's like, yeah, so your platelet count is usually like at least more than like 140,000. Mine was like 9,000.
Wow. Bro, that's 99% or 90% lower.
Yeah.
That's crazy.
Yeah, so crazy, because he's like, this is bad. Like, he's like, I should admit you to the hospital just for like, because at this point, you know, they say like anything less than like 10,000, like you can have spontaneous like brain bleeds.
Jesus.
Like that's like a known thing. And so I got a platelet transfusion, and then he was like, the only reason I'm going to send you home is because I know you're right next door to me, and your mom's a nurse, and that's how it is. But he's like, you're to drive home, not leave the house until you have until your next appointment with your pediatrician, which was like the next day pretty much.
Yeah.
And because he's like, literally like the smallest little bump, like you could have some
the brain thing,
brain or anything. Like if someone hit me in the ribs, like something bad in like, you know, my stomach could have happened. So he's like, you just don't know, and you have to be really cautious. So I was like, oh man, geez, okay.
Sounds serious.
Yeah, exactly. I'm like, but once again, I'm 15, so I'm like, what does this mean? Like, can I go boating still? We're supposed to be going boating this weekend, you know? I'm like, so I remember showing up, and this is where the PA will start to like kick in. So I remember going to my first pediatrician visit, and I met with the doctor that day, and then he brought in his PA with him. And so like at that age, I feel like all I knew about at that time, and I'm sure I'd met with a PA or a nurse practitioner before, but I only really ever knew like there's a nurse, and there's a doctor, and there's a pharmacist. Like in my mind, that was the big three that I knew of in medicine. So he brings in, they're kind of telling me about it. And he's like, this is my PA that's working with me. He's the one you'll probably be seeing most days. He's like, I'll see you for the first appointment and then I'll just follow up with you briefly. So I was like, okay, yeah, sure. Cool. This guy seems cool. So like he kind of talked me through it. And then little did I know how long of a process this was going to be, Steve. I'm sitting here thinking like, this is like a,
give me a medicine.
Yeah. You pop a pill in
and
it's like, give a few days, week. I don't know. You're back. No, brother. This was a long
platelets.
Yeah. So they came out. And so since it's idiopathic, they don't like know how to treat it. Right. Cause they're like, well, I don't know what causes it. Their best thought is that it's some sort of autoimmune like thing, that it feels like it's something attacking your body. So just like any other autoimmune stuff, for a lot of this stuff, we'll give steroids to it. So I was on steroids and they pretty much just said steroids. And then you're going to come, I think I went for the first little bit when my platelet count was still so low. I went like twice a week for the first like 2 weeks. And they like kind of rose, but nothing like significantly up. Like, I'm talking like they're like 30,000, like, and so they're still significantly, wow. So it's still significantly low. And so during this time, then I started having to go more. And this was about the time I had learned a few important things that started me to realize how serious this was. The PA I was meeting with was like, so no football. Like you cannot have any contact sports. And I was like, dude,
no
what?
varsity.
Yeah. Like, so I was like bummed about that. Plus all my friends were playing. So that was like our time to hang out. And he was like, it's at that age, like the friends who had birthdays sooner in the year, they're driving. So they're like wanting to like go and show you their ride. And you're like, dude, yeah, we can finally go to McDonald's by ourselves now. Like, let's go. Like, and so couldn't do that. True. Couldn't do that anymore. And like we had a boat that we liked to go on, and we didn't get to go on the boat anymore. So I was starting to feel like low key a bubble boy. Yeah. Cause like it was seriously, it was like you.
And at that age too, you're like kind of like actually missing out. And so you almost feel like embarrassed too, right?
Yeah, exactly. Cause then like, they're all 15. No one understands it. Right. I'm like trying to explain stuff to them. And people are like,
bubble boy can't hang out today, and you're like, bro, exactly. I swear I want to.
Yeah, like, my dude, platelets are low. I promise I'm not bailing on you, man. Like I might bleed. I don't know. Yeah. And so when I started to go to these appointments, dude, I was getting so frustrated because like,
fix me now.
Yeah, I'd go in time and time again, and he'd be like, oh no, man, the platelets today came back. They went from 30 to like 30,500. Like, and I'd be like,
I don't care. Fix it.
Okay. So this isn't doing anything. So I started getting like low key depressed, right? I was like, all my friends were out doing stuff. I felt like I couldn't do anything. I really wanted to play football. I couldn't do that. And my experience with the doctor that I had, he was super cool dude. It was just like how it was set up for him and I was the PA spent most of the time there. And the doctor pretty much just came in and would be like at the end of the appointment and be like, hey, I saw the platelet count. So we'll see you blah, 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 blah days. And we'll check back in. And it was actually Zane. That was the PA that I met with at the time. He was the guy who really kind of like let me open up, and I was like, dude, this sucks. Like, I hate this. And he was like, just, he was able to spend a lot of time like in those appointments. Cause before that, anytime I'd ever met with people before that, it was always for like a physical, where you're in and out. So like, I never got to really like spend time with people. So that's when I very first learned about PAs. Cause I was like, what, like, so you're a PA? Like, what is that? Like, I had never really like heard of it. So he was kind of telling me about it. And like the first thing that really intrigued me when he told me about it was he's like, you can like do different specialties. Cause in medicine, right? If you're a physician, like a doctor, if you're a cardiothoracic surgeon, you're a cardiothoracic surgeon. Next week, you can't go and be like, hey, I want to go be a neurosurgeon. Cause that takes more training. Yep. As a PA, we can switch specialties back and forth. So like there's people that do like, for example, I work in an ICU, but I also have a PRN job where I work as a trauma physician assistant. So similar aspects, but totally different, fields and everything like that. So he was telling me about that. And I was like, that is cool. Like, and then he started telling me about the school, and he's like, it's less school and some other stuff. And then the other thing he kind of stuck out to me, he's like, my work-life balance is a little bit better than maybe I would argue some of the doctors are. Cause he was like, I can, come here, go to work. And then when I'm not here, like I can spend time with my family. I don't have to like, have as many responsibilities at time. Not that like people that are PAs couldn't not have as much. It's just, I would say typically the work-life balance is maybe a little bit better sometimes for PAs. And so that all that stuff at that age, I was just like, dude, that's awesome.
Yeah.
And so I really started to make a good connection with him. Ultimately, after I think it was about like 4 months,
Bruh.
4 months, the platelets finally went up and I didn't have to keep getting my blood drawn all the time. And that was kind of the last I saw of Zane until I like got a little bit older. Like I started working at a hospital. And then while I was there, I was like, dude, I should go shadow him.
I was going to ask, did you hit him up?
Yeah, so I went and shadowed him. And
sick.
so then
Shout
I got to
out Zane,
like,
bro.
yeah, so I got to go and like spend a day with him and like a few days with him. And then he knew some friends. So then I shadowed some of friends.
Cool.
So like he did pediatrics and then his other friend did ENT, ear, nose, and throat.
Okay.
And so I went and shadowed an ENT physician assistant. I was like, okay, cool. And so like I got to see a few different areas, kind of got their workflow, saw like how they did it with like how they worked in collaboration with their doctors. And I was like, dude, this is a pretty sweet little gig.
Yeah.
And so it was about that time that I was like started at the university in my undergrad. And I was like, dude, I'm just going to go for this. And so that kind of started the whole thing is like, I got this ITP thing, like depressed as could be. And I met this really cool dude who like took time out of his day to like spend maybe that extra 5 minutes.
Yeah. Just being with me and
That
letting
meant
me
a lot,
like
right?
vent and
then,
like, yeah.
And in my head at the time, like, I'm sure it wasn't if I wanted that doctor to probably spend more time with me. I'm sure he would have. But in my head, what came up that time was like, oh, dude, the doctor just says hi to me. It's this guy who's spending time getting to know me, like helping me feel better. And
developing the relationship.
Yeah. And I was like, that is so cool. Cause like, that's what I wanted to do in my head of like helping people. I was like, I love science. I love like anatomy and such, but like, I also love talking, getting to know people. So I was like, this is what I want to be doing.
That's really fascinating. And I did not know any of that. That sounds like...
I figured you did.
Dude,
I don't think we'd ever talked about it.
I was going to say, that sounded like a pretty shitty summer.
Oh, dude. Yeah, it was miserable, dude.
Yeah.
Like when they told me I couldn't go like wakeboarding for the entire summer, I was pissed.
Yeah, for sure. You're like, dude, what do you mean? We just got the boat.
Yeah, I want to go tubing. We
Yeah,
just bought a new
literally.
tube. It's awesome.
That's right. That's so funny. So like now as like a trauma PA, so like what is your like day to day, like what are your responsibilities?
Yeah, so when I work my trauma job, during my trauma job, so I work at a level 1 trauma center where I work PRN, meaning just per diem. So when they need extra help, when their like staff don't have enough staffing needs, I'll go and help out when I can. And so we go there, and any traumas that come in, we're responsible to go and help manage the traumas. And we work coincide with the emergency department team, and we help manage like, blunt trauma, meaning usually any sort of like people fall off horses or people get in motor vehicle accidents, or like penetrating traumas that'd be like stabbings, gunshot wounds, like, that type of stuff. And we go in and we stabilize them, and then we help manage them afterwards as well until they're ready to leave the hospital pretty much.
Okay, gotcha.
And then in my other job in the ICU where I work at, I work in a different place as well. That's my major place of occupation. And we have 3 different ICUs there. So kind of like I was talking about. So there's a medical ICU, like I said, basic infection and respiratory stuff, and obviously vast variety of other stuff, but in general. And then we have a surgical ICU and like a neuro ICU, like a brain ICU. And then we have a cardiovascular ICU.
Okay, gotcha.
And so how it works at that one, so I only do nights, which is kind of unique.
Both jobs?
For both jobs. I only do
gotcha.
nights. And so you can do a little bit of everything, but I'm like a night owl at general. Like even when I'm not working, I'm pretty much going to bed at like 1 o'clock in the morning. That's just like the run of the mill for me. So like to stay up extra the last like 4 hours until like the shift's done, it's not that big of a deal for me. And so what we do each day in the ICU, we go around and we round on the patient. So I get there at 6. I get report handoff, just like we're doing now. It'd be like you talking to me being like, yeah, we got, Bill, he's in room 101. Yeah, he got stabbed this morning.
Nice.
We're treating him with blah, blah. We sutured up this and all that kind of stuff. And then I'm like, okay, sounds good. And so usually what happens is they'll kind of give you like some things they might need you to do over the course of the night. Like, hey, we've been watching this, but can you keep an eye on this overnight? And then sometimes there's times they're like, oh, he's chilling. He should hopefully just sleep tonight. Watch over and kind of things. And And at that time, so from 6 until about 8 is when I go around and I like see the patients typically.
Okay, this is 6 p.m.
6 p.m. Yep.
Okay.
1800 in my town. You know, I like to always military time for me because it just makes more sense in my mind.
Yeah.
So that time I'll go around and see the patients, and I go in and I try to do this to everyone. Sometimes I don't always have as much time, but I'll go and I'll listen to their heart and lung sounds and like kind of talk to the patient, get a little bit about to know about them a little bit. Also, why I do that though is so like if I get a call in the night and you're like, hey man, I'm taking care of 105. They just look kind of crappy. So then I can go in there and be like, oh no, I saw him earlier. It's crappy as it is. Like he's actually looked like this all night. So like, but
it's like building like the reference, like
totally.
That way when you go see him again, you can like see up or down or
it's normal. Like those before and after pictures of like, you know, when you start a diet and stuff like that, you can be like, oh, this is what I looked like before. This is what I looked like after. There's no change, or like, oh great, I'm worse, better kind of thing.
Damn it.
So it's usually worse for me, but that's like that's where it's at with me when I start my shift, because then it helps me keep that kind of pinpoint. It's also cool because we also have the physician assistants and the nurse practitioners who I work with, we come in at 6, but nursing doesn't leave until 7.
Okay.
So I have that little hour time frame as well to ask the nurses that were on during day shift, be like, hey, how was he during the day?
I see.
And then from that 7 to 8 period is the time when the night shift nurse comes on, and I can be like, hey, what'd you get in handoff? Like, is there anything you have questions about or like concerned about kind of thing? And then at 8 o'clock, we go around and we do rounds. Like we walk around as a team, myself and the doctor I'm with, and we just kind of come up with a plan for the night of like, hey, you know, this is what we're doing first. We're going to start this antibiotic and we're going to stop this. And this is kind of our goals for the night. And then from that point on, that usually takes about like 2 hours or so, depending on like how many patients we have. And what we do after that is admissions, any admits that need to be brought down to us, and then any procedures that may need to be done, and any fires that need to be put out is how I always put it.
Oh, not literal fires.
No, not literal fires, gotcha. But clusters that need to be put out, like
gotcha.
You know, things that aren't going well.
Okay, I see. I think nurses are known for working like 12 hours. Is that a standard for you too?
Yeah, so we do 12 hours. My shift is technically 13-hour shifts. And so it goes from 6 until 7, but that 6 to 7 time, like I said, is your time for handoff. So it just depends how fast you can do your handoff, you know, and no one like is trying to rush out of there, but there's usually never takes an hour. Sometimes it definitely can. Yeah. But that hour is your time to kind of like give handoff, finish any like charting you may need to do, and then you're good to go. So like there's some days I'll get out of there, it's like 6:15 in the morning. And then there's other times it's like, you know, I'm leaving at like 7:30 in the morning. It just all depends on what the night brought and stuff.
Yeah, and I think I remember texting you. It was like, to me, a normal time, like 8 a.m. or something, 9 a.m. And you were like, bro, I'm still at work. And I was like, bro, like, oh, you worked last night. Dang. Yeah. And it's still going. Yeah. Okay. Gotcha.
Yeah. Because it all just depends, like, just how much, like, because sometimes, you know, you're just doing so much crap by the time you're actually able to sit down and chart. It's just so late. And I'm also a procrastinator of charting because I just don't like it. So
yeah, literally.
That's literally like the last thing I'll leave, you know?
Yeah, like put me in the action.
Yeah, exactly. I'm like, let me do the real things. I'll figure out this other stuff later.
Yeah, the paperwork later.
Yeah, totally.
So like something that you mentioned that I thought was really interesting about PAs is it seems like there's a lot of opportunities that you can move laterally. And so is that something that you have like noticed? Like you said, you are a trauma ICU at your PRN job, but then you're also a
critical care PA.
Yeah. Gotcha. Yeah, like what other things can you go into? Like, do you need extra specialties to move into those things? Yeah.
You pretty much like, I mean, from my understanding of things nowadays, you can pretty much go into anything you want. Like seriously, like I know a lot of people in a lot of different specialties. Like specifically, I know like there's brain, like neurology, there's hepatology, which is, you know, liver, there's nephrology, which is kidney, there's hematology, which is like blood and stuff, and there's infectious disease, like you name it, it's out there. You typically don't need extra specialties. Like I was talking about how I did like a fellowship. Right. You can do that. And there's usually, I think there's a lot more coming out recently. You can do a lot of those. Like I know one of my friends did, even I had one friend do family medicine. They did a family medicine, and it's all just people who want to get a little bit more experience, maybe be a little bit like more prepared for the real-time gig, right? Because, you know, when you do this fellowship, you get that year of like, okay, I'm like a PA now, but I'm not like in the PA, because like you're still like being trained and you still have someone watching over you and such. So it's like dipping your toes in, but not jumping all the way in.
Okay.
And so that's kind of cool. You can do that. But otherwise, I would say, to my knowledge, I don't know, at least in my field, there's not any certain specialty or like special stuff you have to have. You can like get different things, and based off of like, for example, like I did like ATLS for my trauma job, which is advanced trauma life support. And then in my other ICU,
that's like a certification.
Yeah, like a certification and everything. And anyone can do it, right? It's just like paying the money to take the course and you get certified. Even a normal pedestrian off the street could take that course.
Oh, okay.
So, but those are some things like you have to have in order to do some of the different roles.
Gotcha. What kind of career growth can a PA have? Like, you come in, you graduated, so you're like a level 1 PA, or you know what I'm saying?
Yeah.
Like that's kind of how it is in software engineering, or other engineerings. Is you start off as a associate or level 1, and then it's pretty road mapped until you reach a point where you can like become some sort of manager, or continue down like it's called individual contributor route.
Okay.
In PA like world, is that something that happens, or when you graduate you're a PA and that's it?
You know, this is I've had a lot of people asking this. My mom asks me this all the time. It's like she thinks I haven't done good enough for her or something. You know, she's like, oh, so where do you go from here? And I'm like, well, I mean, so you can do like different things within like kind of your own area. For example, like I have a supervisor over me, right? So you can be like a supervisor of the ICU for the advanced practice providers, which APPs is what like NPs and PAs together are called typically. And so like she's our supervisor, right? But then she's also she's the chair of this NPPA subcommittee. Okay. So there's like that type of stuff you can do, but it's just like being like, you know, the chairs of different like departments and organizations. To my understanding, like once you're a PA, you're a PA. Like you can maybe do other stuff, but to my knowledge, I don't know of them. Right. So that's where I'm at with it. Is to my knowledge, you've reached it.
Okay, gotcha. That's so interesting, because that's definitely the pattern that I've picked up talking to medical professionals. It's like you enter your field and that's your field. Yeah. And it's just so interesting because that is not at all the experience that I have with engineering. Yeah. And so that's all I know. And so it's cool hearing like your structure.
Yeah. Yeah, because it's very drastically different. Like, because they obviously keep track of like your years of experience. Like when you apply, like it was like one of the very first things they asked, like how many years of experience. But other than that, like they don't like be like, oh, because like I always wondered. I was told at least in PA school that like no one does this, because I was like, dude, you probably have to go to like a really nice PA school to like, you know, because obviously like, you know, you'll hear like there's tons of PA schools out there, and as long as they're like accredited, you know, it's like it shouldn't matter. You would think in your head, but at the same time, you're like, you know, if you're comparing yourself to like, you know, Duke University versus like some other like school, you're like, oh, I went to, you know, Williams X, you know,
some no name.
Yeah, exactly. But it's an accredited university. You're like, you would think if they were comparing, you know, you two together, they'd be like, oh man, well, he went to Duke. That's like, it's, you know, a little nicer school, you know, or something. But I never felt like that. So I think like I always tell people that too, because I like meet people, they'll be like, dude, yeah, well, I'm really trying to get in it, blah, blah. And I'm like, oh, that's cool. Well, you know, make sure to apply to others though too.
Yeah, true.
Like that's totally not gonna matter when it's all said and done. No one ever,
as long as it's accredited, for sure. Which makes sense. That should be
exactly. No one ever once asked me like, oh, is there a reason why you went here?
Yeah, literally.
Yeah, they're just like, no, you finished? Cool.
Interesting. So with that, can you describe a little bit about your like salary progression? Yeah. Like where did you start and how and where are you now?
Yeah, so I was like thinking about this on the way down, man, because I was like, dude, I wonder like what the national average is for like physician assistants now, because I had looked it up when I very first started going into PAs, and you know, I was like, well, you know, times are changing, right? Like everything's more expensive, so I was like, I wonder what we're salaried right now. So when I Googled, you know, the first AI post that pops up in my Google when I searched it was like the national average is like 127,000, I think is what popped up. When I started my job, you know, pretty much what they did is they asked past my years of experience, because that's how they, at least where I started working, is they wanted to gauge my starting wage was based off of that. Because I think essentially all they're doing is like, okay, he has X amount of years. Great. We'll start him at this tier. Kind of like how you were talking about the progression, but they do that for like your salary. Like after X amount of years, you get a bump in your salary.
Okay.
And then a bump in your salary and a bump in your salary. And so when I started, I can't remember what my very first salary is, but like in general now my salary ranges like from about 140 to about 160.
Nice.
Is about where I'm at. And then my other job that I work PRN, it's a per diem and it's 1099. So it's just like I get a check at the end of the month based on how many shifts I worked, and I get about, 1,000 to 1,500 per shift.
Okay, nice.
And so I just pick those up as I'd like to, and then at the end of the month they just dish those out.
Gotcha.
And like I said, every year, at least in my current job, they give me a yearly raise. And it's usually about the same raise every single time. And so I don't know. I'm
like a cost of living.
Yeah, exactly.
Yeah, okay.
And so I'm probably a little bit different at this job than other people. So I'm what they call salary exempt.
I was going to ask, like, are you hourly or salary?
Yeah, so I'm salary exempt. So salary exempt means that I'm salaried by all means. Like I have like a time, like a set, like blah, blah, X number is what you're supposed to make at the end of the year date.
Okay.
But if I pick up extra, which I can, I still have a hourly rate when I pick up extra. So like, for example, I'm supposed to do 3 shifts per week.
Okay.
So if I pick up anything extra than 3 shifts per week, so in a 2-week time period, if I pick up more than 6 shifts, that would be extra, right? So then I have an hourly rate that I would get for that 12-hour shifts that I'm on, or the 13-hour shift that I'm on.
Gotcha.
I don't get overtime, but I just get my wage.
Okay, I see. Oh, I'm tracking. You don't get overtime, but you still get paid 1x.
Yes.
Over. I see.
Yes,
Gotcha.
yes, exactly.
Dude, that's sick. At my work, I don't.
Yeah, exactly.
Yeah,
See?
I work more and I don't get paid more.
So yeah, that was one of the major reasons why I kind of really like this place where I'm at currently, because it was like, oh, dude, dope.
Yep.
I can work extra and still get paid.
Yeah.
But I'm not doing it for free.
Right.
Because like I have some kindness in my heart, but not that much.
Yeah, literally. Yeah. I'm not here to work for free. No, I also got to eat.
Yeah, exactly.
That's so funny. To you, what do you think the pros and cons are of being a PA?
Yeah, so I think I think about this a lot, because I have a lot of people ask me like, if you could go back and do it again, would you go back? Because obviously usually what everyone always compares to is like, would we go and do something different at like a doctor, right? Because like that's usually who we're working in collaboration with. So one of the things that can be difficult to deal with, that I know some people that I work with have a harder time with this, and I think a lot of it truthfully depends on your personality. Are you okay with someone telling you no? Right? Because like, while we do work in collaboration, we ultimately have the last say, right? Because I can look and be like, hey, I want to start Steve on penicillin, right? And I could give him my reasoning and my thoughts and whatever I may think. And at the end of the day, hopefully you work with a physician that you're in collaboration with, and they can be like, oh, I like that idea, but the reason why I want to do something different is because of blah, blah, or, cost effective, whatever the answer may be. But you have to be willing to accept that, right? You have to be able to willing to say like, my answer could potentially be trumped every single time.
Yep,
right?
yep.
The other thing on that same aspect is, depending on who you work with, in my opinion, and what type of institution you work in, is going to dictate how far you can go with your physician assistant role, right? Because like where I'm at currently, I can do any X number of procedures. I could do anything from putting in chest tubes. I can do central lines. I can do all the procedures I could think of and more. But I also have that physician that's with me. They're like by the bedside with me, ready to go if like they need to step in for something and help. But at other places, you don't always have like a doctor that's there 24/7, at least in like critical care for sure. And so like you might not be able to do all those different procedures at other places, because it might just be, depending on the institution's policies and everything like that. So you've got to understand that like it's going to be drastically different potentially based off of the physician you work with, the policies you work with. The other thing, I think is you start to realize some other careers that I think are interesting. Like I would love to try to find one to get on here for us to hear from you and them. CRNAs, Certified Registered Nurse Anesthetist, is
anesthetist.
Yeah, so they're like an anesthesiologist, but they like have their own like so. This is definitely by all means not what they are, but this is probably the most common sense way to explain it, in my opinion. they're a PA for anesthesiologists.
Interesting. Okay, gotcha.
And so they have there's a high need for them right now, and like their lifestyle seems really nice. And CRNA. So, but anyways, that's like, you hear some stuff that some others do, and like the compensation they get paid versus what we get paid can sometimes be drastically different, you know? And so I feel like I'm well compensated, but I mean, there are days that I put in a lot of work, and sometimes, you know, you see like your paycheck at the end of it and you're like, dude, that 80 hours last week took like 5 years off my life. Literally. Is it worth, you know, this and that kind of thing? And, you know, it just depends. So, but I think that's the major thing for me is you have to have, because you're totally dependent on what doctors you're working with. They kind of help gauge how well your shift's going to be and how well your job is going to be. So if you work with, which I do now currently, I love like every physician I work with. If you can have a good working relationship and build that trust and everything, like, you're set up. But if you don't, I feel like it could make your life pretty miserable. I just think of it like they're your boss, right? So like, if you work with a boss that's super cool, you love your job, right? Like,
but you're right. They also get to say no to you.
Yeah, they get to say no to you. So it's like, but it's cool because, you know, we've all had the good and the bad boss, right? You have the boss that just tells you no because they tell you no because they're in charge, right?
Yeah.
But you have that boss that explains why, you know, why they're doing what they're doing and such like that. And I think that's important because, I don't know, I find that everyone that's going into healthcare is like, really likes that like forever learning experience, right? Like, we're always trying to learn. There's always new research coming out, and like one person may have read something more recently than you that might know just a little bit more. And at the end of the day, like I said, I'm not going to deny it. They went to school for longer than me. So I'm always like totally open to ideas and such like that. But if you can't be in that mindset that you're open to that type of stuff and you want to be the person that's making every decision and like your choice is the answer, you might not always get that as a PA. And I think it's something to keep in the back of your mind.
Yeah, and that definitely makes sense. Like, in software engineering, you're right. We also have leads, and when you pitch an idea, like, it can be brought down. But kind of going back to what you said about how the doctor kind of has the overall arching say, to me, in an ideal world, they are also maybe backing it with like their own logic.
Yep.
Because, like you said, like they also know a lot, and they also went to school, and so that's kind of how it goes in software. You can pitch an idea and you can back it up with evidence, and then people can either agree or somebody can not refute it, but they can like add on or whatever it is. And hopefully they're also adding their own evidence, you know?
Right.
And so you're right. Like, a good collaborative environment is so cool. I actually have a book over there called like Multipliers.
Yeah.
And it's about leaders who multiply their team, and which is like they let their team kind of drive their decisions, you know, within reason, and like making like good, maybe data-based or fact-based whatever ideas, contributions, versus like somebody just squashing you, or the word is called diminishing you.
Okay.
And it's just like they just crush all of your ideas for no reason. And and like you said, going into these 80-hour weeks, that 80-hour weeks are no joke, but also it's like the work that you're specifically in is also incredibly taxing. Like, that's emotionally draining. It's like you see crazy stuff, whereas like other people sit behind a desk, you know?
Yeah.
So yeah, I really commend you for all of that.
Yeah, thanks, man. I know that's like one of the major reasons actually, like, why I feel like I like the ICU so much is because like I've always been like a teamwork guy. Like, no matter what, like I grew up like playing video games, and so like, dude, you know, video games for the most part, unless it's a single player, like you're always playing with friends and stuff. Like,
True.
So that, plus I grew up playing sports, so in the ICU, like, dude, everyone's opinion gets like listened to. Like, I find that more than, I've only worked there, so I can't speak for like every area, but I know in the ICU, like, they always, like, myself and the doctor when we work with, it's like we're always asking the pharmacist, like, hey, did we pick the right like antibiotic here? Is this the right dosage? We're asking nursing, like, hey, is there anything we're missing? Like, you're at the bedside all night with this patient. Like, have you seen something that we're missing? Like, so I just think that's cool because like I feel like everyone's opinion does matter. Like I said, at the end of the day, it's coming down to the doctor, and that's why they went to the most school. That's why, you know, they're making the most money, obviously. And it's like,
and it's their name that gets written
right,
down,
exactly,
yeah.
Because they're the one that's going to be at fault, right? If something unfortunately doesn't go the right way or something, right? Like, God forbid, but it's the truth, right? So like, that's why. But I love that because, I don't know, everyone gets an input and everyone's opinions heard and is at least like thought about. And that's what I think is cool. I just love the collaboration.
Yeah. Do you have any advice for anybody who's interested in becoming a PA?
Yeah, so I always recommend people like, to shadow. Because like I'm telling you, when I shadowed, like I thought I wanted to do, before I went to PA school and I was working in an ICU as like a critical care tech before PA school, I was like, dude, I think I want to do surgery. Like I want to be a cardiothoracic surgeon PA. Like the guy who goes in and works on hearts. That's freaking awesome. I want to be that guy. And then I went and shadowed him. Like one day in the OR, I was like, I'm good. This isn't for me. Like, I don't want to.
Day one,
Yeah,
right?
like I was like, this isn't the lifestyle I want. Like the things that they're doing in there, I don't know if I really want to do that kind of stuff. And so, but then I saw other lifestyles. Like I saw like what the ENT did. So I always encourage people to like reach out. And if you are like, say you go and shadow just a normal like family medicine PA, get your like so-called, toes in the water, just barely. And then once you're like, dude, I'm interested in that. Like, see what else there is to offer. Like, see what other things there are, I think it's important too, because there's lots of things that are very similar, right? Like a nurse practitioners, we have very similar roles, but at the same time, they're different. So if you see like a nurse practitioner, go and shadow them so you can know the difference and see the different things they have to offer and everything. And then I think when it comes to school, I always tell people like, the important part, when grades do matter, is you want to make sure your science GPA is good. I'm telling you, if you don't have a good science GPA, they're going to look pretty fiercely on that, because they're going to be like, dude, these are all science classes you're going to be taking here. Yeah. So if you didn't score well in your science classes in not a graduate level, like it's going to be tough here. And then I always tell people, same thing I was already kind of telling you. You don't have to apply to just the big name schools. Because like when I very first started and I was getting ready to apply, I was like, dude, I'm only applying to like major university schools. Like I'm not applying to any of these no-name schools. Like people are going to look at that and be like, dude, why'd he go there? Like it's not the case at all. Apply everywhere. Look how much tuition is at certain places, because some places are going to be private and we're paying big bucks. And that is what it is. If you only get into one and you really want to do it, you got to do what you got to do. And you'll get the student loans paid off eventually. But and then when you're done, I don't know, just find a career that you love, right? Like find a field that if you do get in, find that area on your rotations that you're like, dude, I really kind of like cardiology. Like I could see myself going into that. And then, when you're out on your rotations, I always tell people, like I've had a few PA students with me now, and I'm like, every rotation you have, you should take it as a rotation, but you should also take it as a job interview.
That's so true.
Every day you're there, right? You're being interviewed every single day. So I always tell people, I'm like, you should be showing up to your shift like 20 minutes early, right? Show up early.
How do you vibe with the team?
Be prepared. Yeah. Like, think about good questions to ask, but don't be annoying. No one likes that either. So I tell them that. And then, just make connections. The best thing you could do in medicine, in my opinion, if you're interested in the field, is more connections you have, the better, right? Because like over the years, I've gathered at multiple different hospitals. So like, I feel like if I had questions or I wanted to like go shadow somebody even now, I could like go and do that pretty easily. So I think that's just some big major steps that I would recommend anyone that's interested.
Awesome. Chandler, thank you so much for taking time out of your day and explaining a little bit more about what it's like being a physician's assistant.
Absolutely, man. It was a pleasure. This is awesome. We got to do it again.
Bro, let's go.
I don't want to stop.
And that concludes today's episode. Thank you again, Mr. Hurt, for letting us clock in with you and sharing your experience as a physician's assistant. If you enjoyed today's episode, please give this video a thumbs up. All right. See y'all in the next one.